Hello friends, welcome to the channel Dewdear Academy. In this video, I have come up with the NCLEX RN question. The question is, a nurse is educating a patient who has been prescribed an ACE inhibitor for hypertension. Which of the following side effects should the nurse instruct the patient to report immediately to the healthcare provider? I will read the question once more. A nurse is educating a patient who has been prescribed an ACE inhibitor for hypertension. Which of the following side effects should the nurse instruct the patient to report immediately to the healthcare provider? Options: persistent dry cough, dizziness when standing up, swelling of the lips and tongue, and mild headache. So which side effect? The question is regarding the side effects of ACE inhibitors. ACE inhibitors are taken for hypertension. So which of the side effect should the nurse instruct the patient to report immediately? Which side effect has to be reported immediately to the healthcare provider? Whether it is the persistent dry cough, or whether it is the dizziness when standing up, or if it is the swelling of the lips and tongue, or the mild headache. So from these are all the different side effects of ACE inhibitors. These are all the listed side effects which can occur with ACE inhibitors, but the most concerned one is swelling of the lips and tongue. So option C is the correct answer. Swelling of the lips and tongue. So when we are discussing the options, persistent dry cough, this is also a common side effect which can occur with ACE inhibitors. When we are taking the angiotensin, ACE inhibitors are angiotensin converting enzyme inhibitors. So when we are taking this medications, ACE inhibitors, it can cause a persistent dry cough, and that is one of the common reason the people may discontinue this medication. One of the reason for discontinuing the medication is because of this persistent dry cough that can occur with this drug. And the reason mainly due to the buildup of the bradykinin. The bradykinin is getting built up, and that is the main reason for discontinuing this medication. And the second option is dizziness when standing up. So the another option or another side effect is hypertension. Hypertension may occur mainly after the first dose of ACE inhibitor. It can cause a significant drop in pressure or hypertension, and the dizziness also occurs because of the blood pressure lowering effect. One of the common side effect is dizziness, as mainly due to this blood pressure gets lowered. So dizziness when standing up, we can call that as orthostatic hypotension. So that is also a side effect associated with this drug. So but it can be managed with the patient education. When we are doing any position changes and all, we can manage it. Orthostatic hypotension can be managed with position changes. Then the third option, the correct answer, that is the swelling of the lips and tongue. So another important, very important but very rare side effect is angioedema. It is rare, but it is a life-threatening side effect of ACE inhibitors, and it can cause swelling of face, lips, throat, or even the tongue, and that can lead to airway obstruction. Mainly this drug can cause angioedema, and it can lead to airway obstruction. It requires immediate medical attention due to this airway obstruction, and that is the answer, because that is the very important thing we have to report immediately to the healthcare provider. So that is the correct answer, option C. Then regarding mild headache, it is not much common, and generally it is not that much dangerous. Mild headache is not that much dangerous, but still that is also a side effect associated with this ACE inhibitors. So from this we have the some of the other side effects also we can look, that is the hyperkalemia can occur, because ACE inhibitors can lead to elevated potassium levels. So when the patients are taking these medications, they should be monitored for hyperkalemia, because it can if there is high potassium level, that can lead to arrhythmias. So that is very important to monitor the potassium levels. Then there can be also another side effect with the ACE inhibitors is renal impairment. Renal impairment means it can affect these drugs can affect the kidney function. So the renal function should also be monitored. RFT, the renal function should be monitored regularly, mainly if there is any existing renal issues at present. And all other different side effects of ACE inhibitors. So I hope this video is useful for all of you.